This morning, Thursday, August 6th, the State Department of Health reported that the number of COVID-19 cases in Miami-Dade County has surpassed 127,000, and nearly 1,800 people in our county have now succumbed to this virus. So let's begin with a long view. These charts show the history of positive infections and percentages of positive infections in Miami-Dade from March through the present. Significantly, in late May, we emerged from our shelter in place and began to reopen our economy. As you can see, the surge that followed was enormous, ultimately dwarfing the infection rate we had even prior to the shelter order. When we started to reopen the economy, we were reporting about 200 to 300 new infections daily, and the rate of infection was approximately 7%. By early July, we had increased those metrics by many multiples. In late June, we implemented countermeasures, namely a broader mask order on June 30th and a closure of restaurants indoors and a curfew soon after. As you can see, the rate of increase slowed down, plateaued, and even has decreased slightly. Now, we can't pay too much attention to the last 4 days, as it was distorted by the stoppage of testing over the weekend due to the hurricane. But we are clearly better today than we were a week or two ago. This is also supported by our hospitalizations, a number that is unaffected by a stoppage in testing. But that number still remains in the mid-hundreds per day, which is still way higher than it should be. So the problem is, while we are doing better, we are still too far above where we need to be. If our goal is to get back to where we were when we emerged from the shelter in place, we have a good way to go. And of course, even when we get to that point, there remains a genuine question as to whether we could withstand reopening of commerce and of schools. What will putting 400,000 children and teachers into the economy do to our infection rates? One major obstacle to reopening is our beleaguered contact tracing effort. Contact tracing is the process by which state health workers will call newly infected people to advise them how to quarantine and then reach out to their close contacts to limit the spread of the virus. Candidly, the state really botched its contact tracing program when we first started reopening our economy. They were woefully understaffed and had not implemented best practices. In New York, for instance, every person infected is called daily, offered hotel rooms and meal delivery to make sure that their state can control community spread. In early July, our contact tracers were not even reaching 80% of those infected. I can't assure you our state won't be caught flat-footed again, but we are working with them daily to help this effort raise its game. If you do test positive and you get a call from a contact tracer, please cooperate, as it helps those around you and our entire community. Another obstacle is us. While most of you really seek to follow all these measures that have been put in place, too many still object, complain, or figure this as someone else's problem to solve. I'm amazed by the level of vitriol directed at the city, at my colleagues, and at me. So let me make this point. At our current level of infection, our county is sometimes watching 40 or 50 people perish every day from COVID. One day last week, DOH reported 96 people passed away in just Miami-Dade. 96 souls lost. We are paying the piper every day for someone's inability to take the appropriate measures to protect our community. We can't normalize something that should never be normalized. The losses are someone's parent or grandparent, spouse or sibling, a friend or coworker, or just a stranger. They are not all extremely old, as if that could even justify the loss. 40% of those who have died in Miami-Dade are under 75 years old. And when it comes to hospitalizations, more than 50% are under age 65. For those of you who think we just need to open everything up, regardless of consequences, or are upset because of this closure or that rule, please consider this. We already know what happens when we don't take precautions. And we know from the last few weeks that adhering to countermeasures actually works. If we just opened everything, if we did what you asked for, the data clearly supports that the number of people who are hospitalized and who would die would be multiples of what we are already experiencing, multiples. So if you want our economy back, fully back, if you want to open restaurants and schools, if you want a normal that is remotely proximate to our old normal, then do all the things being asked of you. Just wear the damn mask. It's not a political statement. It's a statement that you care enough to make this very modest sacrifice. And for the younger people, you need to control that part of your brain that makes you think your actions have no consequences. You'll have the rest of your life to live it up in crowded places, in close proximity to friends. But for now, please govern yourselves differently, just for a few more months. Look, this will eventually be behind us. It will, when we finally get an effective and available instant test, which is being worked on, when we have plentiful therapeutics that assure most of those infected won't get seriously sick, when, God willing, we get a vaccine. But until then, we all need to lean into this more assertively, to make it our responsibility and not the other guys, ours. To those businesses and workers most impacted, especially those without the resources to easily withstand this challenge, I can only imagine the feeling of helplessness of these times. But please know, we will do all we can to get you back on your feet. And if you are having trouble accessing some of the government assistance out there, our city can help. Until then, thanks for your patience, your calm, and your sacrifice. Please stay healthy and mostly at home.